Okay, orthotics for posterior tib dysfunction. Now, come on in. We'll talk about posterior tibialis dysfunction here. I've actually done quite a bit of research, a lot of self-study on posterior tib dysfunction, and there's a lot of controversy as far as actually whether the posterior tib dysfunction is what causes an arch to collapse or whether it's something else. And there's stuff that I've written that talks about that you can certainly look into and we'll direct you to later on. But posterior tibialis tendon actually courses down to the inside of the ankle, around through here, and inserts on pretty much for the most part on the navicular bone right through here. It's got some slips to these other bones in the middle of the foot as well, but its primary attachment site is the navicular. Okay, so its function is to, of course, as it contracts, it tends to rotate the ankle in this way, and it has what some of the research says a stabilizing function for the arch, because if it's attached right through here and it contracts, you'd think biomechanically would hold that up. And then, common sense, biomechanically, if you lost it, it might collapse down this way. But like I said, there's evidence to the contrary of that biomechanical theory. So when it comes to orthotics, to try to control the stresses that are placed upon the posterior tib tendon, and pretty much common sense would tell us we're trying to hold up the inside of the foot, because the people that have an overpronated foot, when it overpronates and goes down this way, we're going to be stressing that tendon. You're rotating in, putting a drag on the tendon, causing the irritation, causing maybe an itis to occur initially, so a pain syndrome. As it progresses, it can actually partially tear, which can eventually lead to a complete rupture of that tendon. Okay, so there's many aggressive things that have been attempted as far as different types of bracing that go up higher into the against the tibia to create more of a 2 to a 3 point pressure system to, in a sense, try to create more leverage to try to prevent that foot from rolling in. But for our purposes now, we're going to talk about orthotic to try to do that. So, like I said, in most cases, the foot's down like this. So if it's rotating in like this, and what happens, the literature tells us, is that the axis of the joint actually deviates more towards the inside. So instead of it coming down this way, it actually turns more towards the inside. Okay, so it actually moves away from it. It actually moves more in this direction, the axis of the foot. Okay, the axis of the subtalar joint. Okay, which is pretty much the joint in between here and here. Okay, we don't get kind of complicated with the terminology here, but for our purposes, we're just trying to prevent this rolling effect, and we're trying to push that foot back so that axis of the joint doesn't deviate so far to the inside. So what can we do to accomplish that? Okay, of course, hug an orthotic up against here, and this is same thing. This is more controversial as far as the posting strategies go. Some research says yeah, some research says no, as far as it's having the effect that we think that it does. But posting it to rotate it this way, and posting the front here to rotate it up this way. So in a sense, you're trying to roll the foot to the outside over here. By posting it here, hugging it here, and then rotating it out this way. Okay. In my other videos, I talk about how posting here could strain the fascia, or it could stress this big toe joint right through here as you bend through. Okay, but these are things we've got to figure out what the worst problem is in some of our patients. If the worst problem is this, but they have some issues over here, we'll try it and see if it makes it better. If it makes it worse here, then of course we've got to figure something out and grind off maybe the post here to allow this to sit a little bit lower than the other four toes. But for strictly a posterior tib dysfunction, I'll start with posting rear foot into the forefoot. Okay, go right to the toes. As I'll show you here, same sort of thing, hugging up over here. I'll post it in the rear foot. You can see that, 5 to 7 degrees, whatever, on the outside there. And then I'll do the same thing in the end over here. Okay, so I'm essentially trying to create a better, more advantageous lever arm to the axis of the foot. I'm trying to shift things more laterally to the outside and not allow things to roll towards the inside. And we can do that with all kinds of different densities of materials, these being different densities of EVA foams. We can use splinting, we can use more thermoplastics to accomplish this, but the concepts are the same. Hug here, try to post it this way, higher on the inside than the outside here, and then the same thing over here. and then modify as needed if there's other concurrent issues. And that's it. Thanks.